Hello, my name is Eve McIntyre. I'm a cognitive behavioural psychotherapist. I hold full accreditation with the BABCP. In my introduction video for today, I'm going to be explaining a little bit about CBT, how you might be able to benefit from this. I'll explain a little about my own individual approach to therapy, a bit about what you can expect from the sessions, and if you might be interested in doing some work together, how you can get in touch. So when we think about CBT or cognitive behavioural therapy, this is a form of psychotherapy that is recommended in NICE guidance for depression, anxiety and PTSD. CBT works by looking at two key domains that can contribute to us feeling quite stuck in feelings of depression, anxiety and PTSD. The first area it looks at is our thoughts. So this can include our interpretations, our beliefs, but can also link with cognitive processes that we carry as well, such as attentional biases, and how we process that information and where our focus for attention is as well. The other area that it looks at is our behaviour. So we sometimes develop sort of quite instinctive changes in our behaviour when we feel depressed, anxious, or if we're experiencing PTSD, for example. These behaviours may be beneficial in the short term, but in the long term they could be maintaining those difficulties. So CBT is designed to give alternative strategies, alternative thinking patterns, alternative ways of being to help you navigate these situations and difficult emotions that can come with feeling depressed, anxious, or when you have PTSD. What you could expect from CBT as a therapeutic approach is that the initial stages would be spent formulating. This is where we map out and get a really clear shared understanding around what your main problem is. We would also take some time to work through past experiences or factors that have contributed to your main problem. CBT, on the whole, is very much an approach that is focused on the here and now, but we are also a product of experiences that we have gone through. So it's reasonable that we would take that stance with having a bit of curiosity around situations or experiences that could have contributed and led to feelings that we have in the present day. Once we have sort of been able to sort of formulate and gain a shared understanding around what your main problem is and the impact it's having, we would then start to look at what your goals are, what you might be wanting to change about what you're feeling, how it may be impacting and how you want that to be different. And then at that stage, we'll then think about techniques or strategies that are evidence-based that could then really help support you meet those goals and reduce the impact those feelings are having on you. In terms of my own individual approach to therapeutic work is that I see everyone as very much an individual. So whilst it's, I guess, quite natural that you could expect we would have anxiety or depression over a lifespan, actually how we experience it can be really different person to person. And actually it's really important to sort of acknowledge that, not just in terms of maybe how you're feeling as a result of your mental health, but there may be things that are really important to you as an individual that you'd want me to consider. So I've used adaptive CBT to try and capture that I'd really try and tailor our therapeutic work to you, not just the problem area that you're bringing, but also preferences for maybe how you like to work or ways that could sort of be beneficial for you, so that you come away feeling that the therapy has been very much individualised to you, that the techniques that are covered really resonate with you, that they're really applicable to the goals that you have, and that it feels much more personalised. If you are at a place where you're looking for therapy, I can appreciate that can feel quite daunting, and finding someone that's the right fit is really important. So with that in mind, I offer a free 20-minute initial consultation. This gives a really good opportunity for us to explore if we could do some work together, if you'd be comfortable in working with me, but it is also a really nice opportunity to explore any questions you might have around, for example, whether CBT might be beneficial based on kind of what you're going through. So if this is something you might be interested in arranging or exploring doing some work together, you're more than welcome to email me directly or fill out my contact form. I've included a slide at the end of this presentation with my email and also a link to my webpage which has a contact form on it. I do hope you found this helpful and I look forward to hearing from you. Thank you.